I'm sorry. Can you repeat what you said? Oh, come here.
Huh?
I'm sorry. You can go ahead.
Okay. So each of those little wart-like lesions on the stalk are forming because there's a large surface blood vessel and it is growing out with skin around it. And so if we hook those or tear those, they bleed a lot. So by removing them, we reduce the risk of tearing them off and then bleeding your house. So we remove these when we can. And so what I did is most of those were charged as a wart, and all the little ones right down the sternum I just charged as a single wart because it was just pink, 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 pink. Okay?
Okay.
So I did that one very well. Now, I believe it's your sister who owns Bella, and you're taking care of Bella right now. Am I correct?
Yes.
Okay, so I talked with her early on right after I took the x-rays of the chest, and she authorized going ahead with the procedure. And so what we found with the x-rays of the chest, the heart looked good, and there was no fluid or cardiac disease evident, but there were two small nodules in the chest that were very well circumscribed, so they had a very hard line around them. And they looked like BBs. Now, if I'd seen a whole bunch of things that looked like cotton balls, poofy, and spidery kind of white puffs all over there, I would have absolutely canceled the surgery. Okay. I talked with your sister about this at length. When we have a hard nodule with a good hard line around it, this can be scar tissue, and it can be a slow-growing tumor, but it's not likely to be a metastatic lesion, and because they were very, very small, we decided to go ahead with the surgery after we held a conversation about that.
So those are you say, are those considered tumors in her lungs? Is that
yes,
what?
Yes, and that's why I took two views. One was a lateral, and that one, if we just had one, could only see it on one view. Sometimes you can get a superimposed skin nodule that can show up. We took the second view, and we could see it on the second view. So there is something near where the trachea bifurcation occurs, where the trachea splits into the two long lobes, and it is right near where the lymph nodes are, right above the base of the heart. Okay.
Now is that? I mean, I did some googling research. Is that like? I see that tumors in lungs are pretty rare with dogs, but are kind of common with boxers. Is that true?
It all depends on the breed. These are ones that did not look like a metastatic tumor. It did not look like it was affecting her lung as a whole, and it was a quiet lesion combined with her very good blood screen. Your sister and I decided to proceed with the surgery. If it had a cottony appearance, a wispy appearance, those are bad lesions. Those are often metastatic lesions and are usually rapidly expansile and lead to death within 1 to 4 months.
Right, that's what I saw that online. That's what I was concerned with her lifespan.
That's why I talked with your sister before we went ahead with the surgery.
Good.
Okay. So no, she knew about that before we even started.
Right.
Okay.
So you don't see her you don't see a time limit on her life as at this point?
At this point in time, I do not. That is a very quiet-looking lung lesion. I would probably recommend taking another X-ray of it in 6 months, unless we have any coughing episodes, in which case I would X-ray sooner.
Okay.
And I'll have a call back in your file in 6 months to take that picture. Okay.
Okay.
Chin lesion. Again, mostly skin and a good blood vessel. It was a wart on the top of the nose, and then a wart on the toe, and then those little skin tags along the chest. The tooth that abscessed was absolutely the carnasal tooth, and we had a nice picture of bone loss from around that. And as soon as we had taken that one tooth out, the level 2 category includes a total of up to 4 extractions. And so, since we had documented that all the rest of the teeth were looking good in the mouth, except for those 2 loose teeth, we took those very loose teeth out to prevent further pain and decay in the future, so we didn't get another dental abscess. It did not change or increase your bill in any way. As soon as we went for that carnasal tooth, we went into the level 2 category, which we knew we were going to do right away.
Right. Yeah. They told me. I asked if I got charged for taking out the front teeth.
You didn't get charged extra for them. They were included in category 2.
Right.
I could have taken a total of 4 teeth.
Right. Yep.
And the one that took all of the time, was that carnasal tooth. It's got 3 roots, and we have to get the drill out and go down this way and go down that way and take the X-rays to make sure we got all the roots and everything like that. And so it's a great big crater I make and everything, but it closed beautifully, and the skin looks great. We had a nice clean X-ray when we were done, and the incisors were going to have a problem within the next 1 to 4 months. So rather than risk putting her under anesthesia again, since it wasn't going to increase your bill at all, we took those other 2 teeth out so they would not cause a problem in the future.
Excellent. Now, how should the I bought flea and tick medication. Should I not apply that until
wait 2 or 3 days? Make sure her tummy is feeling good and she's okay with her medications. I don't want any extra chemicals other than what we're already doing.
What should I be feeding her?
Just what the technician said: soft foods for 2 weeks, and so.
Can I feed her? She normally
no
eats.
Food tonight. You can feed her a mouthful of something small tonight, but I wouldn't go out of my way to feed her a huge meal. It may come right back at you very quickly.
Oh, okay.
Okay. Sorry about the e-collar. You had said yes, and my technician had heard me talking with you, and you're still saying no. And so she had assumed that you had declined it, not realizing that you had said yes after the fact. So I do apologize. I put it on the invoice.
Whoa.
And,
Bella just collapsed a little bit. She just fell over. Her eyes were shutting, and but I think she's just drugged.
She's probably A, tired, and B, stoned. We gave her some really good pain meds. Okay.
Now, I don't give her any pain meds or antibiotics tonight. I just continue doing it tomorrow with the pain meds in the morning, like the procedure she told me, and then I continue with the antibiotics as normal.
Yes.
What precautions should I take for the stitches? I mean, the cone, should I put her in a small cage while I'm not here?
If she does not like to run around the house, then she can just rest quietly in her own dog bed. If she is an on and off and on and off and on and off the couch kind of dog, you may want to consider kenneling her. Really and truly, none of these are high-tension sutures. So my biggest thing is don't let her eat hard dog food, because crunching on a hard treat or hard dog food will break the stitches in the mouth and expose that root that I sutured, or that cavity where the root was, to break each of the sutures, and that's hard for me to fix, and it hurts a lot healing if we don't have those stitches in place. So the hard dog food is your biggest thing. All the others are non-tension sutures, so as long as she doesn't decide to climb Pike's Peak, it's pretty hard for her to do damage with it unless she rubs her face, rubs her foot, or rubs her belly. So carpet swimming is right out.
Now her belly's already bleeding a little bit, but I don't see it bleeding extensively. So
which one is bleeding a bit?
The one that was the bigger skin tag.
Okay. The big
right in the middle of her belly.
Okay. Just let her getting up, walking, and moving in the car can cause a little bit of oozing. So just let her lay down on a clean towel and give her some kennel rest, and it should close. But they were all nice and clean and dry and closed, so a little bit of movement. It takes a good 24, 40 hours for that skin bond to really set, so a little oozing within the first 48 hours is pretty common. Too much movement, like a car ride, can cause some oozing to happen very easily.
Okay.
I will be here tomorrow. Call me if you need me. Okay?
All right. Thank you very much, Dr. Hennessy.
Right. Be safe, and again, may she be well. She seemed pretty comfortable when she left. That was my hope. Okay?
Thank you very much.
Take care now. Bye-bye.
Bye now.